My name is Grant Holcomb, and I sit on the Agoyo board. And we are pleased to welcome Dr. Helmut Braun to as a presenter today in our October What They Are and Why You Need Them. Welcome, Helmut.
Thanks, Grant. Okay, so I'm going to work and see if I can get my screen to share here. Give me just 1 second, folks. And I think that's coming through. Let's see if I can get this in presentation mode here. There we go. All right, I think we're ready. All right, so a little bit about insurance, healthcare, retirement planning today, why you need to have them. I'll just quick give you a bit of my background. So I'm actually, I work for United Healthcare, so I'm more in the healthcare business, although we do sell some financial products as well. I've been doing this for probably about 30 years, specializing in healthcare. My division actually works specifically on large self-funded plans for big employers, but we certainly do have components that sell individual and small group products as well. So kind of things that everybody has some opportunity to buy at some point in time. And obviously also familiar with some of the affordable care plans because we are in those markets in some segments. So let's just jump into this. Let's go to the next page here. We'll talk a little bit about retirement planning, health insurance, and what it is and why you need it. Try to give you a little bit of background on all of that. And we're going to start with the retirement. So the one key that I will tell you here is that, it's best to start when you're young. And this graph kind of depicts that for you. And if you look at this, it has an example of what would happen if you invested $5,000 annually. And the first little line is if between the ages of 25 and 35, you invest $5,000 annually, a total of $50,000, you'd end up with $602,000. Okay, and you can stop at age 35. So if you just do that for 10 years, from age 25 to 35, you're going to accumulate $602,000. On the other hand, if you wait until age 35, and it shows Bill here investing $5,000 between the age of 35 and 65. Okay, so total investment $150,000, but starting 10 years later, okay, you typically would only end up with $540,000. So you can spend 10 years investing versus 30 years investing and end up with more money if you start early and do that consistently. All right. Now, obviously, if you do both and you invest $5,000 for the entire 40 years from 25 to 65, you would just add those two up, the 540,000 plus the 602, you end up with 1,142,000. But I think what this really demonstrates is how important it is for you to start early and continue to save for at least the first 10 to 15 years of your career, if there's any way you can make that happen. All right. Second thing we want to talk about a little bit is, how can you save effectively for your retirement? And one of the things everybody knows is that, hopefully there's going to be Social Security around. We can't count on that for sure, but for now, at least it looks like there's going to be some Social Security. But the important thing to remember is that you don't really get that much from Social Security. If you look at Social Security recipients today, the average monthly benefit for people is $1,300. Okay, well, that's not going to get you very far. Okay, everybody knows that it's pretty tough to make a living or to support yourself and your family on even $3,000 or $4,000 a month, let alone $1,300 a month. So this shows the average for all workers, shows the average for retired workers at $1,411, spouses of retired workers 736, and surviving spouses. So this is currently what the average is. Now, obviously, there's small increases in this every year, but it certainly doesn't look like it's ever going to be enough to fully support you. So you'll get a little bit from Social Security, but you really got to plan for yourself. So there's really 2 or 3 ways that you can do that. All right. And obviously the best thing that you can do is if your employer has some kind of program, like a 401k program or 403b program. I mean, those are basically for educational institutions. Okay. Very similar, but they're both programs where you can save money pre-tax. Okay. So what that means is that if you save money and put it in that plan, like let's just say we take the $5,000 that was in the previous example and you put it in that plan, your real cost, okay, after taxes is probably only going to be approximately, let's say $3,500. And that assumes a 30% combined tax rate between federal and state. Okay, so let's assume you pay 25% federal taxes, you pay 5% state taxes, 30%. So if you're saving $5,000 a year, it really only reduces your take-home pay by $3,500 a year. And even if you can't do that, try to do something, all right? And the other thing to remember is that many employers have matching plans. So what that means is if you put X dollars in, your employer matches that. Sometimes it's on a 50% basis. So let's say you save $500 a month, they'll match you with $250 a month. Sometimes if you put $500 a month in, they'll match you with $500 a month. Okay, so in essence, to get $5,000 a month or $5,000 a year, you may only have to put in $250 a month because your employer may match. And so that's the first thing you want to do is make sure that if you're employed by someone who has a program or a 401k or 403b, that you put some money into that, preferably a direct reduction out of your pay or your paycheck each week is the best way to do that and make sure that it happens. And then look for the match that you get from them. If you don't have a retirement program or if you're self-employed, you can do a traditional IRA, okay, individual retirement account. Same kind of benefit. You get pre-tax savings, okay, or you get reductions in your taxable income by the amount that you put into an IRA. So you can do the same thing that you can with an employer by putting money into an IRA. And then the last thing I would tell you is depending on the kind of health plan that you buy, okay, if you have a high deductible health plan, you can also put money into a health savings account. Okay, that has a dual purpose. Number one, that health savings account is to help you with any extra expenses that occur because of health issues. Okay, but if there's money left over in that health savings account, it becomes just like an IRA or like a 401k. It's money that you can take and you can invest and you can have that for retirement after that time period's up. All right, so let's talk a little bit about these IRAs and 401ks, et cetera. If you think your tax rate, typically what's going to happen is you expect that your tax rate is going to be lower when you retire. Okay, so a traditional IRA might be a good choice for you. Okay, you'll pay no taxes until you withdraw the money, and you can start withdrawing money at age 59 and a half without any penalty. All right, so any money that you put in there, when you take it out, you will have to pay taxes on that money when it comes out. And if you take it out before age 59 and a half, there's a 10% extra charge the IRS puts on you because they really want to try to encourage you to leave that money in your IRA for until you retire. Okay, so there's tax advantages when you save. There's no income limit or any restrictions on those traditional IRAs. Roth IRAs, okay, these are a little bit different because a Roth IRA, you don't get a deduction on your taxes when you put the money into the IRA. You do defer taxes on everything that it earns. Same thing is true with the IRA. So, if you put $5,000 in there and over the course of 10 years that doubles and takes the money out of there. Same thing with the Roth IRA, and anything that it earns are not taxable until you actually withdraw that money from the IRA. Now, the time all right, the timing to do this stuff, as we talked about earlier, is to start early. You want to do it now, continue to do it for as long as you can. It might happen, okay? So that's why it's best to start early. When you're young, when you're healthy, odds are that you're going to have an opportunity to do that. You pay no taxes until you get into retirement. So generally, until you reach age 59 and a half, as I already said, you're not going to have to pay any taxes as long as the account's been open for more than 5 years, okay? So it gives you spendable income when you get to retirement. All right, let's shift over to healthcare a little bit and why you need to get healthcare. And I just got a couple of examples here. I mean, you never know what kind of expenses you might run into. All right, and if you don't have health insurance, then obviously you have to come up with that money out of pocket to pay for these expenses. All right, and this is just an example of a full abdomen MRI in Philadelphia, Pennsylvania. All right, and as you can see, the prices vary. Okay. But the thing that I would tell you is that the amount that the hospital actually bills for these services is sometimes double or triple what you'd pay if you're in an insured product, okay, or if you have some sort of insurance plan. So while the cost might be $6,700 at Hospital of University of Pennsylvania, okay, they may well bill $13,000 for that, and the insurance company or the PPO that you're participating in has discounts. And so one of the reasons that you want to make sure that you at least have some sort of coverage is that even if it doesn't pay for everything, it's going to get you access to discounts that the insurance carrier has that you otherwise wouldn't be able to get a hold of. All right, so that's one example. Second, I think we're all familiar with the fact that we have COVID-19 going on right now. And what we're seeing right now is that sort of the average cost of a complex COVID hospitalization can run up to $300,000. Okay, even simple hospitalizations for COVID-19 can get to $20, $30, $40, $50,000 pretty quickly. Okay, but if it gets complex and you get put on a ventilator and you spend, several weeks in a hospital, it can easily run $200,000 to $300,000, and we've seen that with many of our patients that have ended up in the hospital. So something you certainly don't want to bump up against, and you never know who it's going to happen to. Obviously, people who are older and have comorbidity issues are more likely to get into those situations. Also, people who are unvaccinated are more likely to get into those situations. So encourage you all to get vaccinated if you haven't, and take that into consideration. And finally, I'll just throw out this for organ transplants. Hopefully nobody needs one, but you never know when something might happen that causes you to require some kind of an organ transplant. The cost of an organ transplant can be anywhere from $32,000 for a cornea to $1.5 million for a heart. Okay, so all those sort of unusual kinds of events can be very catastrophic and very expensive. Okay, so what I'm going to tell you is that basically, I don't know that you have to have insurance coverage that covers every expense that you have. All right, because most people can afford to spend, $1,000, $2,000, $3,000, okay, for healthcare. But it's when you have these catastrophic events that you want to make sure you have coverage for those catastrophic type events. All right, so let's switch a little bit to sort of understanding health insurance, okay, so that you can figure out what kind of plan it is and some of the terms that we're going to talk about when you talk about health insurance, so you make sure you get the most out of your plan. And it's kind of a unique language a little bit, so understanding health insurance can be a little bit challenging or unique sometimes. So we're going to jump in here with a few terms and talk about those. The one thing that happens is that a lot of plans have what they call a deductible. All right, so when you buy insurance coverage, obviously you pay a premium, and you're going to pay $300, $400, $500, $600, $1,000 a month, whatever it might be. But on top of that, there is some coverage that or some components of healthcare that you're going to have to pay for before the insurance kind of kicks in, as I would say. All right, and so for plans that have a deductible, and it's not uncommon to see a $1,500, $2,000, $3,000 deductible. Okay, that's the amount that you're going to have to pay before the insurance company starts paying their portion of the coverage. All right, so a $1,500 deductible, $1,000 deductible is very common. So you're going to pay all the expenses until you reach that level. And then from then on, the insurance is going to sort of co-share with you, and they're going to pay part of the coverage and you're going to pay the rest. In most cases, this turns into what they call co-insurance, which may be my next term, in fact, or co-payment. Well, actually, all right, we're going to jump ahead one. Oops. Okay, so co-insurance and co-payment are two different things. Co-insurance is the amount. So once you reach that deductible, once you've hit that $1,500 level, let's say, for example, on the next expense that you have, if you go to the doctor and it's $100, the insurance company is typically going to pick up the co-insurance amount, or 80%. Okay, so they would pay 80, you would pay 20. And that happens until you reach what they call maximum out of pocket. Okay, at that point, the insurance company kicks in and pays everything. Now, the other thing that we have in a lot of plans is we have co-payments. And so this is a fee that you pay at the time of service for a specific service or supply. Most common, it's like if you have a primary care office visit, okay, there may be a copay of $15 or $25. Or if you have a specialty visit with a specialty physician, there may be a copay of $25 or $30 or $50. And when you have a copay plan, it starts from the first time that you go see the doctor, and you pay the copay, and the insurance company picks up the rest. okay? There may be deductible on top of the copays for other types of services, but the specific things listed as copays, you're only gonna have to pay that copay amount. This is also very common for prescription drugs. So for a generic prescription drug, you may have a $5 copay. For a specialty prescription drug, you might have a $30 copay, or a brand prescription drug, you might have a $30 copay. We talked a little bit about health savings accounts. So, since you're going to still have some expenses that you incur on top of what you pay for premiums, all right? So if you have a deductible plan, then you're eligible for a health savings account, and you can put money into that HSA. It stays with you, okay? So it's at a bank, it's in your name, and it stays with you even if you switch insurance companies, all right? So if you figure out that your typical out-of-pocket expenses are going to be, let's just say $500 a year, the smart thing to do is open an HSA, put $500 in that HSA, okay? It's pre-tax, okay? So it's really only going to cost you $350. Okay, assuming again a 30% tax rate. And then when you have expenses with your primary care physician or for prescription drugs or a multitude of other expenses, that are eligible for healthcare savings accounts, you can use that money. They'll usually give you a debit card. You can use a debit card to pick up those components of the payment. And that's the best way to do that. Now, if you don't need the money, it stays in your HSA. It builds up over time. It can be used the next year or the year after. And so it's a good way to put away some additional savings for when you have that potentially larger healthcare expense. So let's say, for example, you put $500 a year in there and you have a deductible that runs $1,500 or $2,000. After 3 or 4 years, you may build up $1,500 or $2,000 in that account, and then you'll be able to cover that expense when it incurs. Urgent care centers, these are places where you can go when you have sort of an immediate need, okay, outside of your regular doctor's offices. Okay, typically they're a little bit more expensive. If you go to an urgent care center, your charge could easily be $250 to $400. Okay, so if you're in a deductible plan, you go to an urgent care center and have something done, and it's a $300 or $400 expense, and it's the first thing you've had that year, you're going to have to pay for that. All right. Now, it's much better to go to an urgent care center than an emergency room, because when you go to an emergency room, they run a bunch of extra tests, and the typical emergency room charge can run $1,500 pretty easily. All right, so keep that in mind. When you need healthcare services, try to be an efficient user of the healthcare services if at all possible. All right, and a lot of the insurance companies have tools that are available so that you can actually look up how much it's going to cost you if you go to certain places. That's going to become even more prevalent as we get into what they call transparency in coverage, which is going to be required starting July 1st of next year. Okay, some companies have it today, but everybody's going to be required to have transparency in coverage so that people are going to know in advance how much it costs when you go have something done. And that's one of the challenges that everyone has had these days, is that it's very difficult to know how much something's going to cost, because you basically go to the doctor, okay, he prescribes stuff for you, sends you to get some tests, and nobody ever talks about how much it costs. And there is a variation in cost from one facility to another. And so it's a good question to ask, especially if it's money that's coming out of your pocket, right? So when you have deductible plans, there's a good chance you're going to pay a fair amount of that out of your own pocket. So don't be afraid to ask, how much does it cost? And are there alternatives where it may cost less and I get the same kind of service? Out-of-pocket costs, I talked about this briefly just a little bit ago, but out-of-pocket cost is all the money that you have to pay on top of what you paid for your insurance plan, all right? And most plans have a maximum out-of-pocket cost. So they may have a $1,500 deductible, and then they may have co-insurance that's 80/20 for another component until you hit a max out-of-pocket, and it may be like $3,000, $4,000, $5,000. So look at the plan, look at those components, ask questions when you're buying coverage, and say, what is my deductible? What is my maximum out of pocket? So, worst case scenario, that's the worst that it's going to cost you, or the most money that you can spend. After that, the insurance company covers 100% of all the charges beyond the out of pocket, maximum out of pocket. Benefits are basically what's covered, okay? So, not everything is covered in all plans, all right? And the most typical thing that's not covered are experimental services, okay? So if you go and get some experimental service, it's probably not going to be covered. normal things that happen to you, okay, if you get the flu or if you break your arm or if you get an infection or if you get COVID, okay, or if you need a knee replacement, those things are covered. Okay, so normal medical necessary types of things are covered in your insurance plan, but sometimes there are limitations. All right, so they may limit certain things. All right, so they may limit the number of physical therapy visits you can have, or they may limit the number of times. Sometimes they'll include, vision services. You may be able to go get one eye exam per year. Okay, or if you're buying dental benefits, you may be able to get your teeth cleaned twice a year, and that's preventive care that's covered at 100%. So there are some variations in what's covered and what's not. All right. So what kind of health insurance plans are there? And typically what they talk about is, 3 or 4 different kinds of plans, okay? HMO, most people have probably heard that before, health maintenance organizations. PPO, preferred provider organizations. EPO, exclusive provider organizations, or POS, point of service plans, all right? With an HMO, typically what happens is your coverage is sort of required to be performed by a group of doctors and a set of hospitals. Okay, so you're kind of restricted in who you can go see for normal kinds of elective planned services. All right, and so you're going to buy an HMO, and there may be a hospital in your community or a couple of hospitals in your community, and then some physicians, some primary care physicians, some specialty care physicians, and those are the people that you need to go see in order to get services covered. If you go see somebody else, it's probably not going to be covered unless for some reason the HMO can't perform those services. Then they'll give you the opportunity to go outside of the HMO. All right. Preferred provider organizations are typically much broader networks. Okay. Depending on who you go to. Okay. And let's just talk about the 4 big carriers, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare. If you use one of their PPO plans, you're going to have coverage across the country, okay? There are going to be hospitals in every state. There are going to be doctors in every state, and you'll be able to go to any of those people in the network, okay? And that doesn't mean everybody's covered, but, let's just say that 90+% of the physicians and hospitals in the country are going to be included in that plan, all right? And it is really important for you to go to somebody that is in the network, okay? Because when they're in the network, they have negotiated rates with those physicians and those hospitals, okay? And that's important, okay? Because if you go to somebody that's out of network, those physicians or hospitals can charge whatever they want, and you're kind of at their will for what kind of discount you might get. Sometimes you might still get a 10 or 15 or 20% discount, but the amount they bill might be double or triple what somebody in the network would bill. So it's important to always remember to go in the network, whether it's an HMO, PPO, EPO, POS plan, always look for an in-network provider if at all possible. And like I said, these PPO networks, in most cases, if you use one of the major carriers, are going to be very broad and have lots of choices. So you're always going to be able to find somebody that can do what you need to do. Just be careful not to accidentally select somebody that's not in the network, because a lot of times they're purposely staying out so they can bill somewhat extreme amounts. Okay. All right. EPO is an exclusive provider organization, to some degree similar to like an HMO. All right. The difference is in an HMO, a lot of times what they want you to do is select a primary care physician, which is a good idea anyway, for you to have a primary care physician who you see on a regular basis. So they kind of manage your health or help you manage your health. All right. But with an HMO, that's a requirement. And to see anybody other than your primary care provider often requires a referral. An EPO may or may not have that primary care requirement that you have a primary care doctor selected, all right, but still requires you to stay in the network. And so again, they're going to have a select number of primary care physicians, a select number of specialty physicians. And if you go outside the network, there's going to be no coverage, okay? And last is a point of service plan. And again, this is a little bit different because the amount of coverage you get gets determined at the point of service. So depending on who you go see, you may get a different level of coinsurance. All right, if you see somebody in the network, it might be 80%. If you see somebody outside the network, it might be 60 or 50%. So you're going to pay for half of the cost. All right, so most of the time, I would say you guys are going to be looking at HMO and PPO plans. Okay. Those are the ones that are the most common. Okay. And then within those, you want to look and see what kind of benefits you get. And we'll talk about that just a little bit more shortly here. Okay, I've talked numerous times about provider networks. Okay, and a provider network really just means doctors, hospitals, and other healthcare providers and facilities that have agreed to offer negotiated rates for services to insureds and certain medical insurance plans. All right, now those discounts, I will tell you, run anywhere from probably 40 to 60%. Okay, so if you don't have insurance, you're going to be paying a significantly higher rate. So even if you have very basic insurance that only covers you for sort of catastrophic situations, in the other situations where you're going to a provider or a hospital, even though the insurance company is not covering it, it's going to go towards your deductible, you're still going to get those discounts. So that's another reason that you really want to have some type of insurance at some level. All right, and that's why insurance companies use medical networks or create these networks, okay, is so that they get these negotiated rates. All right, we talked about the 4 different types: HMO, PPO, EPO, and POS plans. I may have kind of covered this already. You know, HMO, again, this is where you're going to probably have a primary care physician within your network, and they're going to act as the caregiver or your gatekeeper of sorts, referring you to others in the network. And so they're the ones that you go see. They want you to go see your primary care provider first. He'll kind of assess the situation and sort of triage and determine what kind of specialist you need, and then get you a referral to one of the specialists that is within the network. PPO networks, like I said, want to see somebody in the network, not a problem. Go ahead and see anybody in the network that you want. You don't have to get any permission or anything. Typically, the premiums in a PPO plan are going to be a little bit higher than an HMO plan, all right? Because hopefully those primary care providers do a good job of managing the costs, okay? And when you need an MRI, they're going to know where it costs $500 for an MRI versus $1,500 for an MRI. And they're going to send you to that location where it's $500. So that's part of the reason, is that the primary care doctors have an incentive to help manage the care within the plan. EPO plans, again, exclusive provider organizations. You can typically see any provider, but it has to be within that exclusive provider group. All right, and POS plans, again, a combination of the two. All right, so a few key takeaways when we start talking about health insurance, okay? And you know what, maybe I should stop here. I don't know, folks, if you want me to give everybody a chance to maybe ask a question or two, or do you want me to just go on until the end and then maybe stop for questions when we're all the way through?
I say keep trucking.
Keep trucking? Okay. All right, so finding health insurance coverage. The one thing I would tell you is the 2 key differences you're going to see in plans. Well, there's a number of things, but the 2 of the key differences you got to look at is a copay versus a co-insurance plan. Okay, and if you get a plan that has copays for some of your basic services, you're going to start to get coverage the first time you go see a doctor or the first time that you get a prescription. Okay, if you get a co-insurance plan, okay, there's going to be a deductible, and that deductible could be anywhere from $1,500 to $3,000 or $3,500. Okay, then you're going to have to pay the first $1,500, $2,000, $2,500, $3,000, and depending on where you set that deductible level, that's going to have an influence on how much your premiums are going to be. All right. So again, deductible is a set amount that you pay for medical services before the prescriptions or any co-insurance kicks in. All right. Out-of-pocket expenses are medical expenses you have to pay for yourself. And again, that's composed of the amount you're going to pay up front for the first, like I said, $1,500, $2,000, $2,500, $3,000 worth of deductible, plus any co-insurance that incurs after that until you get that maximum out-of-pocket. Generally, the lower the monthly premiums, the more out-of-pocket expenses you'll have to pay before the insurance begins to cover your bills. Okay, so if you move that deductible, just like in your car insurance, if you buy car insurance that has a $500 deductible versus $1,000 or $1,500 or $2,000 deductible, it's going to cost you more than if you buy something that has a higher deductible. So same thing's true here. But if you want coverage each time you go to the doctor, or each time you go to the urgent care center, or each time you get a prescription, you're going to look for a copay plan. All right, so here's sort of an example. Let's say you have an individual plan, no dependents, with a $3,000 deductible, $50 specialist copays, 80/20 coinsurance, and a maximum out-of-pocket limit of $6,000. You go for your first annual checkup, which sometimes these are included because it's a preventive service. So they like you to go to the doctor once a year and get sort of a preventive checkup. You know, they're going to probably run a few blood tests to see what kind of cholesterol levels you have, see if you have any hypertension, see if you have any issues with sugar or anything like that. And so those preventive visits, a lot of times they'll say one preventive service visit is included. But you mentioned that your shoulder's been hurting, okay? So your doctor sends you to an orthopedic specialist. And again, this is in a copay plan, so it's a $50 copay to take a closer look. So you go see the specialist and you pay $50, and the specialist charge you know is probably going to be $200 or $250. Insurance company will have a negotiated rate of $120 or $130. So you pay $50, they'll pay the difference. And then he says you're going to need an MRI. Okay, the MRI costs $1,500. So since you have a $3,000 deductible, you're going to pay the entire amount of that MRI. Okay, that $1,500 is going to come out of your pocket. Okay, so now this is where it's important for you to ask questions. You know, if I can choose somewhere else, if you go to a freestanding MRI kind of facility, you might get a lower charge than if you have it done at a hospital. All right. As it turns out, you have a rotator cuff and you need surgery to fix it. Okay, you've got a torn rotator cuff. The surgery costs $7,000. You've already paid $1,500 for the MRI, so you need to pay another $1,500 of the surgery bills to meet your deductible. Okay, and then the coinsurance kicks in. After that, your share is 20%. Okay, so which in this example would be $1,100. All in all, the torn rotator cuff costs you $4,100. Your $3,000 deductible plus 20% of your coinsurance, which is $1,100. All right, so there's also an option, and we talked about this, for health savings accounts, and these are if you have a high deductible plan. There are limits that have to be met in order for something to be considered a high deductible plan, and those limits currently are $1,400 for an individual or $2,800 for a family, okay? If your plan, if you have a deductible plan and you have limits that are in excess of $1,400 and $2,800 for individual and family, then you're eligible to also open a health savings account. All right, and these accounts can be used tax-free as long as the money is used for qualified medical expenses. All right, so just to give you some sense for how much these plans might cost, I talked to a couple of agents and asked them about plans, okay? And I said, okay, if I were a single female, age 28, no history of any health issues, and earning about $30,000 per year, what would it cost me to get a plan? All right. And so to get a pretty strong copay plan, you know, that has reasonable copays for a primary care physician, a specialist physician, you know, $5 generic drugs and $15 brand drugs, okay, the cost is going to be about $500 a month. But because right now there are government subsidies available, okay, because of the Affordable Care Act and the American Rescue Act, okay, the government would subsidize you about $200. And that's all based on your earnings per year, okay? So if you're earning more money, okay, if you were earning $60,000, you probably wouldn't get any subsidies, all right? It's based on X% of the federal poverty level, all right? It starts with, you know, if you're at 100% of the federal poverty level or below, you wouldn't have to pay anything for insurance. It would be free. If you're at 400% or more, then you're not going to get any subsidies. If you're someplace in between, you're going to get some subsidies, okay? I asked them about one more too. I said, what about a two-person couple earning $47,000 a year combined in total family income, ages 38 and 32 with no health issues? And again, a solid copay plan would cost about $950 a month, but with government subsidies, okay, likely available because of the income level of this couple, okay, it would probably be free. All right, so couple of examples of what you might actually find if you go to the marketplace. And what I would tell you is that when you're looking, there's lots of places to look, but there are a number of companies that will shop that insurance for you. So if you call somebody like a Health Markets or an Affordable Care company, they will look across all the possible policies that you can get within your region. Okay, so tell them where you live, tell them how much you make, tell them what your health conditions are. They have tools that will help you look, and they will see how much you would get, how much you would pay with Humana, Cigna, Aetna, Blue Cross, United Healthcare. Okay, they'll put all that stuff in there. They'll figure out which plans are best for you and give you options. Okay, and there'll be a range of premiums depending on what you select. Like I said, a copay plan is going to probably cost you a little bit more. A high deductible plan is going to cost you a little bit less. But what I would suggest at the very least, buy a high deductible plan, even if it's a $5,000 or $6,000 deductible, because when you do that, it gives you access to the network of providers that the insurance company has negotiated deals with. And you're going to get better rates if you have to go, even if you're paying it out of pocket. All right, that was it for what I had. So I'm going to turn it over to whoever for questions. I'll be happy to take a few and try to answer as many as I can.
Thank you, Helmut. Let's see. Are there any questions? Let's see. Looking at the chat. I'm not seeing anything come up just yet.
Okay.
I'm not seeing anything.
All right. Well, hopefully we covered it well, or maybe there weren't a lot of people on there going to watch it in the recording. So
Awesome. Well, thank you so much for being here. And
yeah.
really great. And this is a really great presentation.
All right. Well, thank you all for having me. I appreciate being able to participate today. And if something comes up and somebody has a couple of questions, Grant, if you want to shoot them over to me, I'd be happy to try and respond to them if you need me to.
That would be great. Thanks for being willing to do that.
All right.
All right. Bye bye.
Thanks, everybody. Take care. Have a good afternoon.